I'm Governor John Carney. We're here for Delaware's response to COVID-19 pandemic, our weekly press conference. We've got a full team and a full agenda this afternoon. I'm joined by Secretary Susan Bunting, the Secretary of Education. I'm going to talk a little bit about our schools, the experience getting schools reopened, how schools are operating, and the challenges that they're facing. I must say we're getting really good effort by teachers and educators across our state under very difficult circumstances as they teach their children remotely, some in classrooms, and deal with all the public health protections to keep teachers, staff, and children safe. Dr. Carol Rattay is Director of the Division of Public Health, is with us again. We're going to talk about new data calculations that'll help us as we look to focus on areas across our state where we're experiencing a little uptick, better understand the percent positives basically, and really moving towards, I think, a criteria that's consistent with what most of the other states are doing and with what is being recommended by CDC, Johns Hopkins, the New York Times, as they publish these data. I think it will help us better understand the number of positive cases that we're seeing on a day-to-day basis as a percentage of the tests that we're doing, and Dr. Rattay will get into that and the different approach that we currently take on that criteria. And then we're also going to hear from A.J. Shaw, our Director of the Division of Emergency Management here in the state of Delaware. His team, he continues to be our testing czar and testing thousands of Delawareans each week and helping us get a better understanding on where the spread is across our state, where it isn't, and some of the challenges that we face. So we're going to talk a little bit about schools. We're going to talk about data and how we calculate that data, a new metric there that we'll be adding to our data dashboard. We're going to talk about testing, as we always do, and we'll continue to try to get the message to all Delawareans to wear a face mask, a face covering when you're in public. It is a small sacrifice to be made, and we learn every week that it's more important than ever to make sure that people, even in public, even outside, are wearing masks. They're protecting mostly others that they come in contact with. If they are shedding the virus, they're positive and they may not know about it. Obviously, if you have symptoms, you should not be circulating in public. You should see your physician, get tested. We are doing and making tests available for everyone who wants them, and we're testing people once, twice, 3 times, and we'll continue to do that as we manage the spread of the virus here in our state and try to come up with a new normal. And a new normal is that we're going to bring kind of businesses back online. We're going to be careful about that. We're going to protect employees. We're going to be conscious of mask wearing when there are other people around and social distancing. We're going to gradually bring children back into schools. Most of the school districts are going with fully remote learning at the moment, but they're thinking through how they move some of their student populations back into in-person instruction with teachers. And most of that focus is on children with special needs and children in the elementary schools that need that personal interaction the most. And we're also going to talk about our efforts to continue testing thousands of Delawareans on a weekly basis. And so let's go to our data dashboard. Again, we're over 21,000 total cases with 276,000 negative tests. And we'll see a different calculation of the total testing later as Dr. Rattay talks about this new data point that we're going to be looking at. Sadly, 646 total lives lost. Overwhelmingly has been the case in the very elderly, nursing home and other vulnerable populations, those with pre-existing conditions, but each one of those a precious life. Mother, father, grandmother, grandfather, a neighbor, somebody that we've known and loved throughout their lives, and each one is a sad occurrence for all of us. Hospitalizations are trending up, a little bit concerning there. 87 that are currently hospitalized, and we'll take a look at that. So just over 11,000 positive cases in Newcastle County, about reflective of the population that Newcastle County residents have as the state total. 3,100 cases, almost 32. In Kent County, somewhat reflective of the population, and then the number of positive cases in Sussex County continue to have the most cases per 100,000 in the population there. A lot of that reflective of the two surges that we've had in our state, one in the poultry industry back in the spring, and then the beach communities as we reopen in June and July. We're seeing an uptick in the number of new cases per day. You can see that at just the 7-day moving average, now at about 140 new cases. You might remember that our target for staying off quarantine list was 97 about a month ago, and we were on again, off again, 1 week on, 1 week off, meaning we were above or below 97. I think we went down as low as 80, and that's where we need to be. That's where we want to be to more fully open schools and businesses across our state. Part of that is because more people are testing positive. You can see the 7-day average of 8.1%. Obviously, that's somewhat concerning. Our target for the World Health Organization is 5% positive. We got down closer to 3% at one point when the number of new cases were down around 70 or 80. So we were seeing an uptick across the board. It is concentrated again in that young adult demographic, ages 18 to 34. Some of that hangover from the summertime beaches, and a good portion of that more recently from college and university towns as students go back to campus and off campus parties and social events. We do have a very good relationship and have with the University of Delaware, and the University of Delaware and the city of Newark have combined forces and are really trying to enforce the off-campus social gatherings where so much of this activity, we believe, occurs. Here's our 14-day view of the data dashboard. You can see, again, hospitalizations are ticking up a little bit, concerning 87. You'll remember, to put that in context, our high point was 337 back at the end of April. Again, the percent positive ticking up a little bit as well, and the same with new positive cases. As we look at the subcategories, and I would recommend to you to look at the data dashboard, My Healthy Community part of it, and you can see by zip code, by geographic area, the various communities across our state. And we're just not seeing one area that's more pronounced than another. A little bit higher in the city of Wilmington, but not dramatically. So it seems like the new positive cases in the Newark University community have flattened out a little bit. It's just kind of a general, malaise across the whole state, where you're seeing a little bit of cases in every geographic area. And of course, that's not where we want to be. We'd like to see lower cases in each geographic area with no surges. And so as we look at the 90-day view, you can see more pronounced the recent kind of uptick there after meeting kind of a trough, a low in the middle of August, where we were going down, as I said, with percent positives in the 4% range, with total daily cases in the 80 to 90 case range, and hospitalizations ticked down as low as 40. With respect to the data dashboard on personal protective equipment, still seeing a backlog on gloves. I think that's a case not just for Delaware, but other states. We've got a big order in and expecting that soon. Everything else is in pretty good shape. As I've said at each of these press conferences, we are using significant amounts of CARES Act funding to support small businesses, to get them over this hump, to support nonprofit agencies, and to rebuild our economy. And that's a major focus that we have right now, is, again, getting businesses more reopened, getting to a place where we can safely reopen schools, more than just the hybrid model. We're not there yet, but all the school districts, superintendents and their teams are working through all of that to get where we want to be. And in the interim, we need financial support for small businesses, in particular those in the hospitality sector, and we've got a $100 million fund to do that. The first increment of that funding applications have been taken, and I believe we're looking at the second increment, and then an additional fund for nonprofit agencies. And so a lot of work going into all of that. Again, thanks to our congressional delegation, Senator Carper, Senator Coons, and Representative Blunt Rochester for their support. I know they're looking at additional relief programs in the Congress of the United States. As yet, they have not been able to come up with an agreement around what that might look like. We would like to see, obviously, the highest priority for the national governors is to see some allowance for revenue replacement. Here in Delaware, we've lost close to a $500 million, $500 million in revenue, which will make our budgeting season moving into next year extremely difficult. So we've got a whole team with us today, starting off with our Director of the Division of Public Health, Dr. Carol Rattay, who's going to talk about some new data points and our data dashboard more generally. Dr. Rattay, thank you.
Great. Thanks so much, Governor. And I am excited to provide some updates today on our the data that we are making available publicly on My Healthy Community. One of the things we've been working on is a new addition to how we present percent positive tests or results. Now, our system in Delaware is a person-based system, and so since the beginning of this epidemic, we've been providing percent positives based on people tested as opposed to the total tests that are done. And many states have been presenting their results in that way, people tested as opposed to total tests. There's value and benefit in presenting the information both ways, and so we're excited to be able to provide the data both ways. A total test is the recommended approach for Johns Hopkins as well as the CDC, and so it's important to us to be able to present data consistent with those recommendations, and an important reason is so that we can compare our data with other states. Right now, if you'll see some of the dashboards that compare states, you'll see that our percent positive may look a bit higher than expected, and in part that is because we're using a different methodology by some comparison points. So by using the total test methodology, that allows for more equal comparison across the states. The test-based results, and I want to clarify this slide a little, the test rate results reporting reflects the percentage of the tested population who is infected, but it also is a reflection of how well are we doing with testing. So the better we're doing with testing, the more people that we get tested, you would expect that number to go lower. The person-based test really, it was very equivalent in the beginning, in fact, even pretty equivalent in the summer, but now that more and more people are being tested and people are getting repeat tests, that calculation is better to assess kind of your overall prevalence or burden of infection overall over time. And so again, they both have value. They're both important metrics, but it's important to us to share both metrics on the dashboard. On the next slide, I think it points us to a New York Times dashboard around this, and I think there's a really great explanation on the New York Times dashboard. It does show you which states are currently doing the person-based, which currently we have an asterisk next to our state, but it looks like about 33 states are using the test-based approach right now. And again, the New York Times does a nice job of explaining the difference between these two. But you will see, once we switch over to test-based percent positives, that our percent positive will go down significantly, and a big reason is your denominator, or the bottom part of the calculation, is total tests, which is much bigger than the total number of persons tested. Again, each has value, but you will see that number going down once we switch over to the test-based approach. And you should see that on My Healthy Community, our website, over the next couple of days, and you'll be able to kind of toggle over from one to the other. So you'll be able to see our results with both. And both show a pretty similar curve in that both were very high, in the springtime, went down, went up during the beach outbreak, went back down, and they're both on the increase again as we are seeing more community spread at this time. So speaking of more community spread, as the governor said, we are seeing some increases in overall case numbers, case rates, and percent positives. Newark, although it seems to be leveling off slightly, we are up to 370 University of Delaware cases. And so a lot of the numbers in Newark do remain driven by that 18 to 23 age group and university residents, university students, but certainly that's an area where, as the governor said, we are working very closely with the university and with the city, and working hard to drive those numbers, those cases down. In Wilmington, we continue to see elevated case rates in 19802, 01, 04, 05, and so working closely with community partners around testing, but also, again, good prevention messaging. Western Sussex, also, as of this week, we've been seeing a little bit of increase in the Delmar and the Laurel area. Greenwood continues to be elevated because of the long-term care facility there. And also in the Ellendale area, this past week, we saw some slight increases. So there's a number of areas in the state. We wouldn't call them hotspots because they're not hotspots, but they are higher than the rest of the state, and we're keeping a close eye on these areas and taking that multifaceted public health approach to testing and prevention in those areas. So long-term care update, the 3 facilities that we have been talking about have all seen a slight increase in residents and staff who have tested positive in those areas. We also now are monitoring an additional facility in Hockessin, Regal Heights Healthcare and Rehabilitation Center, which has a total of 13 residents and staff who are positive. One thing I did want to point out is you may have noticed in some national media that a number of long-term care facilities have received testing, antigen tests from the federal government, and a number of those tests in facilities across the country, and including some of our facilities in Delaware, have seen some false positive results. When we see those positive results in staff, we are backing them up. Actually, I should say with residents. Staff are being tested with a PCR test, but if residents are tested by an antigen test that's positive, they're treated as a positive, but we do confirm it with a PCR test. We have seen some, not many, false positives in our facilities, but none of this changes the way we respond, which is, in all these facilities, we are seeing increases in cases among staff and residents, which means that weekly testing among staff is so critically important, and all of the infection prevention approaches that are critical, whether it's appropriate PPE at all times, and making sure that people are isolated and quarantined as is appropriate. It's really critical that those measures are followed. Another thing on our dashboard that we're really excited to be able to share is a chart that looks at venues that are visited by positive cases. So what we started doing in July is for every positive case, we ask them if they have been in certain high-risk settings. And among the cases that we interviewed, around 25% every week tell us that they have been in one of these high-risk settings. So now if you go to our My Healthy Community website, you'll see this venues chart under contact tracing, and you can see that restaurants are the most commonly visited venue, but also gyms and bars are up there as commonly visited venues by people who have tested positive. Now, that doesn't necessarily mean that's where they got their infection, but within the 14 days prior to becoming positive, they were in one of those venues. Additionally, events are, again, fairly common. House parties remain the most common event that people who became positive participated in, but also weddings and religious services and other large gatherings are up there as well. So we'll keep making that available to you on a weekly basis so you can see kind of where people may have been exposed. And certainly, again, we want to remind people that if you do have compliance concerns at all, whether it's gatherings or businesses, please send your complaints to hsbcontact@delaware.gov. Oftentimes, it's really the only way we know that there is an establishment or some event that we need to be keeping our eyes on. And then finally, I want to make a mention about Halloween. We did issue guidance for safe fall festivities just this past Friday. Our guidance, like much of our guidance, is risk-based. So we're not saying that you can't celebrate Halloween, but we really want to promote low-risk activities, like activities within your home, might be pumpkin carving, decorating your home, holding a virtual costume contest, a movie marathon, etc. Other ideas that are low risk that won't put anybody at risk for getting COVID-19. But then there's also some medium risk activities that do involve being out of the house, out and about, but if done safely, meaning always face coverings, always social distanced, people can do them safely. So that might be, going to a pick your own pumpkin or apple farm, or a trunk or treat that has been approved by public health. That means it can be done safely. Additionally, trick or treats, which we know many people are interested in. We are not recommending your normal door-to-door trick or treat this year. On the other hand, we have guidance for how it can be done safely. So if one family stays together and they don't come in personal contact with an individual, but an individual puts their treats on their doorstep and stays 6 feet away with a mask, face covering, again, it can be done safely. So please take a look at our guidance and see what's on there. Other high-risk things include haunted houses. I wanted to give a shout-out to Frightland. They worked with public health to get a solid plan. Our team was out there last weekend. They said they didn't have any problems. They were using a reservation system and really adhering to the social distancing and face covering guidance. So again, we can still have fun this fall, but it has to be done safely.
And it has to be done with a mask on. Imagine that. Halloween, this is an easy sell. Wear a mask on Halloween. We've been having trouble getting folks to wear a mask, but on Halloween it should be easy. Thank you to your team, Dr. Rattay, for all their work on that guidance. I was on the call this morning with the mayors of towns across Delaware, and they were very appreciative of the guidance that you gave. I think they thought it was basic common sense, consistent with everything that they've been talking about and we've been talking about. Do Halloween, but do it carefully. They're obviously canceling big potential spreader events like the Sea Witch Parade in Rehoboth and like some of the events they have in Lewis, but Middletown and other communities across Delaware, they were pleased to get that guidance that you provided, and so that there can be some Halloween. Great information on the testing. You know, we use a number about 300,000 in terms of the number of tests being done, because it's the number of persons that are tested, and when they get tested a second or a third time, as I have and others have, you know, you add those tests up and you're close to 500,000, and we're missing 170,000 or thereabouts in our calculation. And so we'll be able to compare our testing results and percent positive better with New York and New Jersey, who use this measure. It's often why I wonder why their numbers look so good. That might be part of it. But they use that measure, as do most other states, and is recommended by CDC. So my understanding, we didn't have the systems to do it early on, but we've worked through that to set up a different database, and that's going to be a good and helpful thing for everyone to make those numbers more meaningful, because as you test a second, a third, a fourth time, as we expect to do, particularly with teachers and educational staff, those new tests under our current way of calculating don't count for the equation. So that certainly diminishes the usefulness of that data and that data point. So we'll present both data sets on the data dashboard, and folks can see it for themselves. Dr. Bunting, lots of things happening, lots of challenges in our schools and with the Department of Education as we try to assist schools in the reopening process.
Thank you, Governor. As a reminder, we have shared this scenario picture with you before. If you'll remember, back in August, it was based on data announced that schools could open with scenario 2, which is an in-person remote combination that we call hybrid. Districts do have local authority to open under a lower model, which is model 3, if indeed they could not get ready for their hybrid model by the typical opening of a school year. So some districts did, and charter schools did choose to open their academic year under the remote-only choice. Others have chosen to begin in the yellow. Some of our ones that opened in the red situation are moving to yellow. So this month we're going to see more of those districts actually providing some in-person choices to students, and there still would be the remote option for our families. If you take a look at the next slide, you can see the current status for school reopening. We are very interested in the metrics and consult them constantly. Right now, if you look at the numbers and compare them to the previous chart, you can see that we are really firmly in that yellow status. We will continue, as I said, to monitor our stats and to make decisions based on that. But we are constantly talking with our school district superintendents, our charter school leads, our private school leaders. In fact, on a daily basis, I send emails several times a day to that group of people. If you take a look at what's happening in our school year, I mentioned that there are choices locally determined. We have 6 districts at this point that are offering some form of in-person learning. We have 6 districts that have limited services to select students. These are often our special needs students or our EL students. Or in one district, they're actually bringing in students that they are aware have no internet connection still. 10 of our charter schools are also offering some form of in-person learning, and 4 additional districts are going to be offering in-person options later this month. In addition, we keep a very close watch on cases. Naturally, we are reporting those cases and working closely with the Division of Public Health, who is tracking, and as you could see earlier or hear earlier today, publicly reporting on COVID cases among our students and staff. In the first month of this school year, DPH reported 29 cases statewide among our public school educators and students from September 1st through October the 2nd. In addition, DPH has reported 27 cases among our private school educators and students through last Friday, and 20 cases among Delaware Child Care Center students or educators in the month of September through last Friday. I want to take this opportunity to again thank our Child Care Center educators, many of whom have been working all through the summer, and now in a new capacity with students who aren't in school to help them through this pandemic challenge and to offer safe learning environments for our students, which is a necessity if their parents and their caregivers are going to be able to work and provide for their families and provide the essential services that we need throughout the state. Over the past month, I have been visiting schools across the state that are offering some form of in-person learning. Things look differently. As I mentioned, local control has outlined various plans. I've been pleased to hear from educators and students about how they have overcome the challenges to return to school buildings and how they are continuing to adapt to meet unforeseen changes that continue to offer students face-to-face learning opportunities for families who choose that option. I've been really pleased as I have been there as buses have unloaded on the first day to see the smiles of children, and you can see the smiles even though you can't see their mouths because they're all wearing their face coverings, but their eyes light up and they're very glad to be back interacting with classmates. I've also been really impressed by the teachers' enthusiasm. They have been involved for weeks in planning, problem solving, coming up with ingenious solutions as to how to do what they know is best for the education of our students, and yet do so with the restrictive environment that we need to be maintaining in order for our students to stay safe and very healthy. So as we look at this, I mentioned we have various rules that we need to follow. Wearing face masks is really important, and we know that that has proven to be one, if not the major factor in keeping safe. We also have the distances, and our schools have maintained those distances of a minimum of 3 feet, but in many cases, the full 6 feet that we're trying to schedule for desks and seating on buses and so forth. We wash and sanitize hands frequently. In fact, throughout schools, you're going to see all these sanitizing stations and frequent use of that in classrooms and hallways, in cafeterias and so forth. And we also have worked with our parents to make sure that if indeed any kind of fever or not feeling well is detected, that our students stay at home until they're sure what the situation happens to be. We've learned a lot about doing this safely. We have public health liaisons in our schools that work daily with our educators. They are available 24/7 by call, and this is something that the Division of Public Health has offered to our districts, our charters, and our private and parochial schools. We also have worked out a system of notification so that if by chance there is a case detected in a school, that we make everyone aware of that, and everyone then can take the proper precautions. Face coverings, as I mentioned, are absolutely required, and even though there was some doubt at the beginning about whether or not our younger children could maintain the rules and keep on their face masks, we've been delighted in the fact that they know what they have to do. And with very rare exceptions, with some of our students with special needs, all of our students are continuing to wear face masks all day long. That includes outdoors if social distancing can't be maintained. And we did arrange our desks. There's been a lot of geometry going on to figure out how you can squeeze as many desks as possible into a single classroom and still maintain that distance. And last but not least, our staffs in schools have done an amazing job in figuring out how to sanitize classrooms in between bathroom breaks, or when children are on playgrounds or in another space, another learning space for some reason. So we are really working hard to make sure that our schools are sanitized and very healthy and safe for our students. I really would like to express a deep appreciation for the people who have worked on teams to make sure that we can educate our children this year. Our child care providers are our partners, our educators, our students, our families, our school nurses, the custodians, the bus drivers, our nutrition workers, all of our staff members have truly diligently worked to make this a possibility for our students who choose to come to our school buildings. And this has been an investment of months of their time. We also have a partnership with DTI. We are working particularly in those areas where we knew we had internet deserts and our students were being challenged by not having access to internet. And so we have invested our CARES money in many of the additional services to students. We've worked on broadband access. We have tried to eliminate those internet deserts. We have over 300, in fact, as of this morning, it was 340 families that have been approved for service. We continue to support efforts to increase just not accessibility to the internet in places where that was not possible before, but we also work on affordability for our families. We have expanded eligibility, and we have set aside funds to subsidize installation and initial service through their work with Blue Surf. DOE is now expanding coverage to subsidize non-standard installations for low-income families. This will immediately add more than another 100 families who have already been submitted, have submitted their applications. Districts and charters will not know if a family is a standard or non-standard family immediately upon submission. This will be taken care of by Blue Surf and by DTI. So again, we thank them for their partnership. Districts and charters may also now request a subsidy for some of our educators who need non-standard installations. So in order to continue to provide our remote learning successfully to all of our students and to enable our teachers to do that from any location, we need to continue our efforts to support and to expand remote learning opportunities. Governor?
So thank you, Dr. Bunting. A big thank you goes out to all the teachers, educators, principals that are really leaning into this very challenging situation as they bring children back into school for in-person instruction with their teachers there and for remote learning and the challenges of that. I have visited some of the districts that have a mix of in-person and remote learning, and two things that stood out to me. One is that the children are all wearing masks. It was something that was thought to be a concern. My guess is it's because you can make them wear them, unlike adults, we have difficult time doing that. Children are in school, you can just make them wear the mask. I was just driving around the town yesterday, and I saw a little kindergarten class, and every one of the little ones had their mask on, and of course the masks are almost as big as their faces and covers so much of it, but they look so cute with their mask. And so important for the children to wear masks, obviously to protect teachers and others in the room. As we think about transmission, Dr. Rattay. The other thing that I've heard is as folks get back into kind of this new normal, they feel more comfortable with all of it as they see that it can be done safely. And so we'll continue to work on that. Part of our efforts to work on that is to do extensive testing among teachers and staff, do testing in communities where children are going back in the classrooms and testing across our state, and our testing czar, A.J. Shaw, is here to bring us up to speed on testing sites coming up.
All right, thank you, sir. Good afternoon, everybody. Right now, the community testing plan is really in 4 different buckets. We have the school testing that I'll talk about, we have our community drive-throughs and pop-up sites, we have the at-home test, and then we have the static sites as well. So I'm going to start with school testing. In partnership with Newcastle County, we are ramping up the community sites to meet the need for schools that are about to go back to a hybrid model over the next several weeks. No registration is required, but it is preferred. Any student may attend, so if one time or day doesn't work, feel free to go to another one. Again, these are going to be run similar to all the other drive-throughs, so they're going to be high throughput, easy access events over the next several weeks. If the weather does turn for the worse, we are going to attempt to do them indoors in either a gymnasium or an auditorium, depending on our location. So just bear with the site managers as they kind of work that through if the weather does look bad, but right now it looks like we have a pretty good week this week. And again, all these results are about 48 to 72 hours delivered back to us. First, I'll start with Newcastle County. There are 12 events this week, kicked off yesterday with Delcastle and McKean High School and some others. These go through Saturday of this week. The capability each of these to test over 1,000 people if need be, so plenty of opportunity. You could go to delaware.curativeinc.com to sign up, and again, you are not required to go to your school district. If something else works convenient for you and your family, that works as well. They're all open to anyone. For Kent and Sussex, we only have 5, but what's not on here is kind of our beginning of a new part of our school testing strategy, which is going to be the reoccurring option for the school district. So Polytech, Seaford, Lake Forest, and Cape Henlopen all opened up, as Dr. Bunning mentioned, over the last several weeks. So we are working with a company to provide access to testing on-site at the districts, high schools, or another school that they choose. Starting next week, we have Polytech and I believe Cape Henlopen on the books, and we'll start doing this around the state as other schools are getting back into the building. So next week we have, this week we have Cesar Rodney. We'll be doing Del Tech in Georgetown as well to make sure we get that part of Sussex County, Milford, and then Sussex Central High School. Exciting announcement. We kind of gave the sneak peek last week, but in partnership with Curative, we took delivery of a trailer that they will staff, actually starting tomorrow. Tomorrow we'll be at Woodlawn Library in West 9th Street in Wilmington from 10 to 6 to test people. That link will go live this afternoon. On Thursday, we'll be at Hicks Anderson Community Center as well from 10 to 6. So these are, walk-up reservations are not required, but are preferred as well. Both these sites will be on the website by the close of business today, and we're also adding events for Friday, Saturday, as well as next week around the state. So this is just another layer that we'll do to get down to the community level a little bit closer to make sure we meet the needs of testing across the state. Dr. Atay did a great job explaining how the numbers for testing are, the denominator might not all be the same, so I wanted to kind of follow up and just let people know what we've done with Curative. So Curative, we've been in partnership with since May. It's one of multiple labs that we use in the state to do COVID testing, but over the last 14 days, we've done about 30,000 tests. If you look at this by day, if you take the weekends out, we've done anywhere from 2,000 to 4,000 tests per day. So, as we've talked about, we've seen a little decrease and increase, but I think testing is continuing to stay strong. The access is out there through multiple sites, the at-home access, the static locations, et cetera. So just wanted to give an update on that. So 30,000 tests in the last 14 days, almost the same number of results that have been delivered. Those results are delivered back to the patient within 48 hours or underneath 48 hours from the sample collection, and the average time in the lab is under 12 hours for the last 7 days. We're even going to work with Curative over the next few days to shrink those times a little bit. Some of the speed bump we see is if I go this morning, I get tested at 9 o'clock, that shipment might not go out till tonight. What can we do to do a shipment in the middle of the day to get stuff down in the lab a little bit earlier to maybe cut 6 or 10 hours off some of those time frames. So we know we have to get people tested. The access has to be there, and also the results have to be delivered as quickly as possible as well. So big news, billboard today is look for the trailer at Woodlawn Library tomorrow, Hicks Anderson Community Center on Thursday, and more locations on the website over the next few days. And sir, back to you.
All right, so get tested, get tested, get tested. Wear a mask, wear a mask, wear a mask. Even on Halloween, you don't even have to fake it. You can just do your civic duty and wearing your normal mask, and you're all set to go. So lots of things happening, particularly with the data dashboard and this calculation that will make us more consistent with other states, and also recognize that now we're getting to the point where we have folks that are getting tested a second, third, a fourth, and more times, and in fact plan on doing that, particularly for teachers. So testing is an important part of managing the virus as we move forward, but contact tracing, which is the effort that follows up on cases or tests that come back positive, and we would really request that everyone who gets a contacting trace, please take the phone call and engage with the interview with our contact tracers so we can better understand where you might have come in contact with folks and protect others, and where you might have gotten the virus, and so we have a better idea of where the spread is coming from, what are the hot spots. Dr. Rattay did give you some idea of some of the venues that cause concern. It shouldn't be anything new to any of us. Large gatherings, indoor spaces, spaces where it's difficult to social distance, meaning keeping 6 feet from somebody next to you, wearing a mask, always indoors in public, need to wear a mask. It's really for the protection of others, to keep your particles, respiratory particles, contained within that mask and not spreading, so others can pick up that virus as you're shedding. And so it's important that we continue to get tested, and that individuals get tested when they think they may have been exposed. To that point, I would encourage everybody to download COVID Alert DE. This is an app that you can voluntarily sign up for. It's anonymous. It enables you to know if you've come in contact with somebody who tests positive subsequently within 6 feet for more than 15 minutes. And so it'll just give you an alert, and you can know that you've been in contact with somebody anonymously that is testing positive. That person is also somebody who's participating voluntarily, who indicates when then they get a call from public health that they've tested positive, that they can trigger the app so that other people can know who they might not be able to identify. So it's a really good tool to help each of us, and I would recommend it to you. So bottom line is, we've got this little bit of an uptick. Some of it could be the fact that we're moving back to fall activities, circulating a little bit more, letting our guard down when we're in public or we're in enclosed spaces. Most of this activity happens in unstructured house parties, off-campus parties for the college students. Things aren't structured like a restaurant, a bar, and even there's risk. And gyms, I know when I go into my gym and I see too many people there, I just kind of turn around and go out and not subject myself to that potential risk. So we're also moving into the flu season, and so we ask everybody to get your flu shot. And the big concern there, again, is hospital capacity. We talked about it last week. A normal flu season, you'd see several hundred that are hospitalized with the flu. You add to it now, we've got 82, I think the number was today, on COVID-19 hospitalizations, and you're starting to talk about numbers that start to approach our capacity, which, depending on the day and elective surgeries, it could be in the 400 to 500 or more range, as we saw back in March. So help us prevent the spread, quash the virus. Stay at home if you're sick, by all means. Wash your hands for 20 seconds. Most importantly, wear a face mask at all times if you can, particularly if you're indoors and can't maintain a safe 6-foot distance from others. And you're really doing it for the benefit of others, and thinking about your neighbor and thinking about getting businesses back with more customers and getting our schools reopened more for in-person instruction. So thanks to the team here, Dr. Rattay, Dr. Bunting, AJ Shaw, our testing czar, and all those who are on the front lines in public health. They've been just working their tails off day in and day out, addressing the challenges and that we've had over the last 7 months now, going on 8 months, I guess, and a lot of really challenging and difficult work during that period of time. So I know we've had some pre-submitted questions, and we have media in the room, and Sarah, we give you the floor if you want to take it and ask questions before we go to our pre-submitted questions from other media. Thank you for attending and for your good work.
How are you, Governor?
Thank you. Good, thanks.
So with the caveat that we're going to expect a more accurate picture of the positive case count with this new data that's coming out, the percent that was on the website today is around 8.1% last I checked. That's the highest it's been in months, right? So is the state heading in the right direction? If this uptick continues, are you going to have to take additional measures, any action, restrictions?
So it's something, is it concerning? Yes. Do we see any specific outbreak? No. If you think about the numerator, right, it's the new positive cases on a day-to-day basis. So let's talk about that. So the quarantine from New York, New Jersey, and Connecticut target was 97, and we were above it and below it. As you may remember, we got down into the 80s, and now just the last 4 or 5 days in the 130s, 140s, and some of that were tests that originally were negative and they came back on a second test and were positive from nursing homes. So a little bit different. You got to really look under the numbers to see if we're just having a broad increase, which I think is what we conclude at the moment. We did have the 370 cases over the last month out of Newark and the University of Delaware. So that can explain some of it. Some of it was a function of testing numbers being down, although the most recent numbers were very strong. As people get tested more than once, we don't count them in the denominator, so that takes that. So the combination of those numbers is concerning, and it's not headed in the right direction. You're right. Is it to the point where we want to tighten things down like we did the last time with zip codes along the beach communities? Not to that extent yet. We will continue to look at it on a day-to-day basis, week-to-week basis. We do our press conferences every week. But my message is to every Delawarean is if we don't want to go backwards, let's follow the guidelines. Let's wear a face mask in particular. And let's be careful in public settings, particularly indoors, at the stores, at the various indoor locations, the supermarkets, and all those places that we go. Wear your mask. Be respectful of others.
Yeah, so if I'm hearing you correctly, people should not be bracing for repercussions because of this uptick.
No, but they should be cautious.
Right.
And they should redouble their efforts. We don't see anything. We thought we were going to see it in the kind of greater Newark area, and we did initially, but then it's started to settle down a little bit. Is it still higher than where we want it to be? Yes. I think we're doing a much better job. AJ, your coordination with Newark PD and University PD, they've sent a very strong signal to the students that those parties are not permitted by local ordinance, and therefore action will be taken by the university. I think that's helped. So we just need to be more vigilant as individuals, and on our side to just be a little bit tougher on enforcement.
Secretary Bunting, we have a question from our education reporter. The Division of Public Health has said that because so few schools are in person, then sharing school-specific COVID-19 data would provide identifiable information. As more schools transition to hybrid, does the state plan to expand on the detail of the data that the state is making available?
We get our data from DPH, so I will punt in a moment, but we believe in being transparent. We're very interested in our statistics, and we plan a lot of our decisions as to what we do and where we go in the future based on those metrics. So we intend to be transparent.
Yeah, we do think it's important to continue to present the cumulative data statewide. We'll be able, as we have more numbers, to break it down. So right now, we're just saying who was in school buildings, but soon we'll be able to break it down to say staff, number of staff in school buildings, number of students in school buildings, in the time when they were potentially contagious. That's what those numbers represent. I also think it's important that the schools, when there is somebody who is in the school building potentially contagious, are also reaching out to the relevant community, so to the parents, to the students, to inform them that there is a potential exposure in the school. Now, we work very hard, our epidemiologists work very hard with every single situation, every potential high-risk exposure, including schools, childcare, to get a full assessment of the situation, to make sure we have a full assessment of who may have been contacts, who needs to be quarantined, and tested at the appropriate time, so that we get the information to the right people so that they can take the most appropriate actions.
Sarah, before you finish, I'd like to address your comment about so few students in school. We have districts that are really serving a lot of students. Cape and Lopin, for example, has 69% of its elementary students in school every day, 5 days a week. And their secondary students are coming in either Monday, Tuesday, or Thursday, Friday. So they have had a tremendous response from the public about getting their students back in school. In Woodbridge School District, you have the students that want to come divided into half, literally, and you're in 1 week as a full-time student, and then next week you are remote and you have switched with the other group. So we're looking at a lot of students. Indian River has all of its K-1s in that choose to come, and they are rolling in their second and third graders this week. So it's working for those who have approached it with a lot of thought and precautions in place, and we are seeing additional students rolling in every week.
So
And
Dr.
if I may,
Sorry.
Sarah, unless you had something to that point.
No, go ahead.
Yeah, so I talked to the superintendents individually to get an understanding of what they're trying to do. And of course, all the ones that are remote are preparing to bring students into classrooms. Most, as we talk, are doing it with special populations, so children with special learning challenges, to bring those in. And they, you know, if you think about the geometry of this, I talk about this, is that they've got to fit, you know, as many students as parents want them to they survey their parents, and those who want a mix of remote and in-person instruction, they try to accommodate that. So in Cape Henlopen, I think it was 60% wanted in person and 40%, you know, a little bit higher than that. And so they've got to do the math. How do you fit the children 3 to 6 feet apart in classrooms? And so that's what they're struggling with now, and it's why each district is a little bit different, because their parent populations are a little bit different in terms of their desire for in-person and not. We couldn't bring all of them 100% right away because of the geometry. You just don't have enough spaces, buses, and all the rest of that. And so they are working hard and figuring it, not just the ones that are in a hybrid, but the ones that are moving to that over the next, so we're beginning of October, the next 2 months.
So Dr. Rattay, just to clarify, so we can expect expanded data to reflect the increase in in-person attendance, if I'm hearing you correctly?
What I can say now is we're going to continue to, every Friday in our press release, present the statewide data that is available, but as we have more numbers, and this may be pretty soon, we can break that out by staff and students.
Okay, thank you so much.
Thank you, Sarah. So we have a series of pre-submitted questions, and I think Haley's there with those questions.
All right, the first question is from Katie Tabling at Delaware Business Times. Governor, when was the last time you were tested for COVID-19 and what were the results? How often do you get tested and how do you get tested? Is it through a private service or are you going to Walgreens or public events like the general public?
So way back in the spring, when we were most of the testing was being done by the hospitals, and it was on the recommendation of your physician for symptomatic people that had symptoms. I was alerted to the fact that one of my staff had tested positive, and so instead of getting tested right away as I would today, I quarantined for whatever the number of days was. I don't remember exactly. We learned about it sometime into that infectious period, so I quarantined for that. Then later in the summer, my youngest son, who was home working remotely from his computer science job in Boston, was feeling sick, and so he got tested, and I got tested. One of those nasal swabs where they went back into my throat, I felt like to get that. So that was the first time tested negative. Then we were doing the curative tests, and I wanted to experience that. It was really great, you know, easy drive up, boom, you're in. I think mine was up at Wilmington University, up on 202. Got my results back in I want to say a day and a half, negative. And then I actually just applied for one of those take it home, do it at home tests, the Vault, what they call Vault?
Yep.
The Vault test, AJ, which is the test that we were using for teachers and staff and educators, and we'll see how that result comes out.
Next question is from Dan Laurelham at Delaware Live. New York City has closed a lot of schools. Are you afraid that Delaware will ultimately have to do that as well?
Yeah, I sort of hope not. We've been moving forward with the expectation that we'll continue to press the number of cases down and percent positive. We're moving in the wrong direction at the moment. We're still in the scenario number 2, the yellow scenario. And so that's why we need to redouble our efforts to do better. That's why we need to get the message across to college students at the University of Delaware and our other colleges and universities to be careful and not carry on social events off campus that become super spreaders. And for everybody to wear a mask when they're in public and they can't social distance, wear a mask when you're outside and in public. It's if nothing else, it's just a way of showing solidarity for your neighbor and for the rest of the community, because it affects the ability of small businesses, particularly in our hospitality industry, to be able to do more business and to accept more customers. Customers aren't going to go back into those venues unless they feel safe, and certainly everybody needs to be wearing masks there. Let's not make masks a political statement. I mean, let's wear masks because it's good public health practice, and it's if you want your children back in school, and we all do, let's wear a mask. So I don't want to go in that direction, and we'll take it day by day as school districts. I know they're hearing concern from parents about that, and particularly looking at smaller geographic areas, and that can be a little iffy because the numbers get really small. When you do that, your testing is not as consistent. You really have to take that 7-day moving average and the statewide perspective, and then start to look at the situation on the ground and whether you're getting larger outbreaks or not. So, hey, I don't want to go that direction. I guess to answer the question simply, but if the data and the spread on the ground suggests that we rethink what we're doing, then we will.
All right, this is the last question we have today. It's from Nick Ciolino at Delaware Public Media. A few long-term care facilities have seen outbreaks in recent weeks. Is there a concern that the state's upward trend in cases and positivity rates, combined with the start of indoor visitations, could lead to similar outbreaks elsewhere? What would prompt a decision to suspend indoor visitations, even at facilities with approved plans?
Yeah, I'm going to defer to Dr. Rattay only to say that protecting our most vulnerable citizens is a high, if not the highest priority. This is the population that has experienced the most fatalities, most at risk. They're our grandmothers and grandfathers, and we want to protect them.
Yeah, absolutely. Vigilance in protecting this population is so incredibly important. I do want to emphasize, though, that among the facilities that are having outbreaks right now, none of them had begun indoor visitation. So indoor visitation is not a factor in the outbreaks that we are seeing. But we do know when you see increases in community spread, that can translate then to increases in staff and others who bring the infection into long-term care. So our focus is really vigilance with long-term care. The weekly testing of staff is so very important, but also all prevention control measures, wearing appropriate PPE at all times in the facility, making sure that if there's any exposure or positive cases, that appropriate isolation and quarantine is followed. And so those measures and working with long-term care to make sure that they are and remain at the top of their game in regards to infection prevention is really of the highest priority for us right now. It is possible if we continue to see significant increases in community spread and increases in outbreaks in long-term care, that we would need to revisit those indoor visitation policies, but we are not there right now.
So thank you very much for joining us today. This is coming to the close of this press conference. My takeaway from the events of the last week or several days is that nobody is immune from the risk of COVID-19 to the highest levels here in our country. The president and people close to him have tested positive, and what that should say to all of us is that we all need to protect one another. We need to wear masks. We need to social distance. We need to be careful. We need to avoid large public gatherings. And we know that this virus is just insidious. If we let our guard down, if we're not careful in those circumstances, we just never know when you're going to be in the presence of somebody who is shedding the virus, who's caught it to him or herself. They may be asymptomatic. One of the things that we've learned, Dr. Rattay, through all of this is that there are a lot of people that are shedding the virus that don't have symptoms, and that means that they don't know that they're sick. And so each of us, if we're going to, again, get it back to a more normal economy with people back to work and with more children in front of teachers in schools, what we ought to do is not forget about the virus and act like it's not here and not take precautionary measures, but just the opposite, to wash your hands, to stay at home if you're sick, to wear a face mask, and to keep at least 6 feet apart from everyone. The Division of Public Health has put out Halloween guidelines. Everybody be safe and wear that mask on Halloween.